Hi everyone, I'm Shane Turner, a Technical Director and Safe Systems Specialist at ABLE. And I'm delighted today to be interviewing Laura Sandt from the Highway Safety Research Centre in North Carolina. Laura's, who I've known for at least 15 years, I think, Laura, is the co-director of the Highway Safety Research Centre, and she focused particularly on research studies and implementation. So today we're going to talk about equity in road safety. Now, back in 2021, Laura and I were both on a consortium that looked at safe system and how safe system could apply in the US. And that consortium developed a document. And one of the things I was really impressed about in terms of that document was the focus on equity in road safety. Compared to what I had been used to in terms of safe system as it applied in New Zealand and Australia. So Laura, can you provide a bit of context about the inclusion of equity in the safe system approach in the US?
I think, in the US, we really spent many years focusing on the 4 E's, which was enforcement, engineering, education, and evaluation. And over time, people realized that wasn't enough. We needed equity. We needed a focus on community education. And I think with the discussion around safe system, we realized as well that the 4 E's are really not a useful paradigm for us anymore. They're not really getting at the system, at the heart of the issue, the mechanism of injury, and they really aren't helping us address the disparities in how people are being injured. So in the US, I know you have similar issues in the countries that you work in. We definitely see a lot of people that are experiencing greater burdens of the injury. It's not equal in all places. We have people in communities of color, people in ethnic communities, young children, as well as older adults that are experiencing higher rates of injury and negative outcomes as a result of these traffic crashes. And we realize that the 4E model doesn't really help us understand those differences and doesn't help us develop the interventions that can really target and address those so that we're offering fair opportunities for all. And so I think that's the context that we bring when we start talking about equity in safe system, is that we need to change our paradigm on how we address injuries, but also really understand that people are experiencing these injuries differentially based on their age, ability, socioeconomic status, and a lot of other factors.
Thanks, Laura. I understand that the Highway Safety Research Centre is doing quite a lot of research in this equity area. Are you able to talk to us about some of those studies that you and your colleagues have been doing?
Yes, one of my colleagues, Nandi Taylor, has been at the Transportation Research Board annual meeting the last couple of years talking about some of her research, which has been really interesting, looking at the legacy of segregation and redlining in the US and how that's affecting our current injury outcomes in those same places. So she did a study that looked at redlining communities from all across the US, primarily urban regions, in which, if you're not familiar with redlining, it was a policy that originated back in the 1930s, where there was sort of systematic disinvestment in communities of color and a prioritization of investment and lending programs and loans to the white communities that were given better grades under the redlining program. And so her research looked back at those maps and the current day rates of pedestrian injuries and saw almost a dose response effect of the lowest graded areas that were historically marginalized and underinvested now have the highest rates of pedestrian crashes. And so it's one of those examples where past and current disparities are bad for everyone. The pedestrians that are walking in those areas can be from anywhere, but they're more likely to experience an injury or a crash as a result of that historic trend. And so it's just one study that really helps us recognize that there's a lot of value in our historical data that we can bring in to our current planning efforts to help think about how do we reach those communities that are most in need that may have been marginalized in the process for many decades.
Really interesting because, yes, you're right. In this part of the world, we also had those inequities as well with our Maori population here in New Zealand, both in rural areas and in urban areas, and also in Australia with the Aborigine population. So First Nation people are overrepresented, but also there are higher levels of risk, particularly for elderly with walking. So I really, it's great to see that research that's been going on, and great to see that we understand the problem. So in terms of the hurdles to actually addressing this inequity, are you able to talk a wee bit about where you see the major hurdles to actually getting better outcomes in road safety, particularly for these marginalised groups?
I think one of the hurdles in the US is that we haven't fully taken advantage of the knowledge within our communities. We often rely on exclusively police-reported crash data to tell us where the problem is. And a lot of times we've been learning that those crash data are actually missing a lot of information, especially from marginalized communities that may not feel the same inclination or trust in the police to report an event. And so there's a lot of opportunity to work more with communities to understand the nature of their safety needs, as well as to rely on other forms of data that help us understand vulnerability. So we've been seeing many communities develop or share processes related to helping identify social vulnerabilities. And sometimes that can draw in really unique sources of data: housing cost, unemployment, transit deserts, when there's a lack of access. There's a lot of interesting information that can help us understand where a community has an unmet transportation need that could reflect an exposure to risk in walking or biking or traveling, that's not necessarily going to show up when we just look at crash data. So that's a barrier in our data, but it's a big opportunity as well.
So in terms of actually integrating this aspect into safe system strategies that at a state, a federal, or even a county city level, have you seen some good examples of how states have been able to actually incorporate that into their safe system strategies?
We're starting to see more analysis of vulnerability. In this last year of federal funding, every state developed a pedestrian vulnerable road user assessment. It was looking largely at pedestrians and bicyclists as vulnerable road users, but many agencies also extended that to consider other forms of vulnerability, whether that be, age, cognitive, mental disabilities, or socioeconomic factors that may create vulnerabilities. And so I think just gathering that data, doing that analysis is a very important part of understanding the problem and developing goals and targets. We've also seen a lot of discussion how equity is not just an outcome, it's a process. And so community engagement, baking that into the process of developing strategic plans, roadway designs, is also something that we've seen I would say a greater emphasis in. And only now people are beginning to ask questions about, participatory budgeting and how do we pay communities for their time so that we're not getting only the community members with time privilege. How do we get really more reflective perspectives in our processes? So I think there's some interesting things on the horizon as well.
Yeah, well, thanks, Laura. That in terms of the New Zealand and Australian context as well, I think the discussions that we have with those minority groups, we find very valuable in terms of developing the solutions. So it sounds like you're doing similar types of things in the US to what we've done in New Zealand and Australia. But thanks very much, Laura, for agreeing to this interview. Really great to catch up with you, and I look forward to coming and visiting the Highway Safety Research Centre next month. Thank you, Laura.
We're excited. Thank you, Shane.